Hello and welcome. Today we're diving into the world of diabetic neuropathy, a common and potentially debilitating complication of diabetes. We'll explore what it is, why it happens, how it's diagnosed, and what can be done to manage and prevent it. Diabetic neuropathy, put simply, is nerve damage caused by prolonged high blood sugar levels. Think of it like this: your nerves are like electrical wires carrying messages throughout your body. When they're constantly exposed to excessive sugar, these wires become damaged, impairing their ability to transmit signals effectively. The primary cause is uncontrolled diabetes, specifically chronically elevated glucose levels. However, other contributing factors include duration of diabetes, genetic factors, nerve inflammation, lifestyle factors like smoking and alcohol use, and potentially, even high cholesterol levels. Now, let's get a little more technical. The pathophysiology of diabetic neuropathy is multifaceted. High blood sugar damages nerves through several mechanisms. First, it leads to the accumulation of sorbitol and fructose within nerve cells. These substances disrupt nerve function and can lead to cellular damage. Second, high glucose levels contribute to the formation of advanced glycation end products, or AGEs. AGEs bind to nerve tissues, causing inflammation and further damage. Third, diabetic neuropathy can affect the small blood vessels that supply nutrients and oxygen to nerves. This impaired blood flow, called microvascular dysfunction, deprives nerves of essential resources, leading to their degeneration. Finally, it's believed that oxidative stress, an imbalance between free radicals and antioxidants in the body, plays a significant role in nerve damage as well. Diabetic neuropathy is extremely prevalent. It's estimated that up to 50% of people with diabetes will develop some form of neuropathy during their lifetime. The risk increases with the duration of diabetes, and it's more common in people with poorly controlled blood sugar, high blood pressure, and high cholesterol. It affects individuals with both type 1 and type 2 diabetes and is a significant cause of disability and reduced quality of life. The symptoms of diabetic neuropathy can vary widely depending on the type of nerves affected. The most common type is peripheral neuropathy, which primarily affects the feet and legs. Common symptoms include numbness, tingling, burning, or stabbing pain. Some people experience extreme sensitivity to touch. Even a light touch can be excruciating. Others may experience weakness in the legs or feet, loss of balance, or even foot ulcers that don't heal properly. Autonomic neuropathy, which affects the nerves controlling involuntary functions like heart rate, blood pressure, digestion, and bladder control, can cause symptoms such as dizziness upon standing, constipation, diarrhea, vomiting, erectile dysfunction, and difficulty emptying the bladder. Diagnosing diabetic neuropathy involves a combination of physical exams, neurological assessments, and specialized tests. Your doctor will likely check your reflexes, sensation to touch, temperature and vibration, and muscle strength. Nerve conduction studies can measure the speed and strength of electrical signals traveling through your nerves. Electromyography, or EMG, can assess the electrical activity of your muscles and can help identify nerve damage. In some cases, a nerve biopsy may be performed to examine a sample of nerve tissue under a microscope. Diabetic neuropathy isn't a single entity. It encompasses several different types. As we touched on earlier, peripheral neuropathy affects the nerves in the extremities, particularly the feet and legs. Autonomic neuropathy affects the nerves controlling involuntary bodily functions. Proximal neuropathy, also known as diabetic amyotrophy, causes pain and weakness in the thighs, hips, or buttocks. Focal neuropathy affects a single nerve, often in the wrist, eye, or leg. Carpal tunnel syndrome, a compression of the median nerve in the wrist, is a common example of focal neuropathy in people with diabetes. Unfortunately, there's no cure for diabetic neuropathy, but there are effective treatments to manage symptoms and slow its progression. The cornerstone of treatment is controlling blood sugar levels through diet, exercise, and medication. Pain management is also crucial. Medications like antidepressants, anti-seizure drugs, and topical creams can help alleviate nerve pain. Physical therapy can improve strength and balance. For autonomic neuropathy, specific treatments are available to address the affected systems. For example, medications can help manage blood pressure, heart rate, and digestive problems. Regular foot care is essential to prevent foot ulcers and infections. The best way to prevent diabetic neuropathy is to prevent or manage diabetes effectively. Maintaining healthy blood sugar levels through diet, exercise, and medication is key. Regular blood sugar monitoring can help you stay on track. A healthy diet low in processed foods, sugary drinks, and saturated fats is crucial. Regular physical activity can improve blood sugar control and overall health. Smoking cessation is essential, as smoking worsens nerve damage. Limiting alcohol consumption is also recommended, and regular foot exams by a healthcare professional can help detect early signs of nerve damage. The prognosis for diabetic neuropathy varies depending on the severity of the nerve damage and how well blood sugar is controlled. Early diagnosis and treatment can help slow the progression of the disease and prevent complications. While some people experience only mild symptoms, others may develop severe pain, disability, and foot ulcers. Ongoing research is exploring new treatments for diabetic neuropathy, including therapies to promote nerve regeneration and reduce inflammation. Some promising areas of research include the use of growth factors, gene therapy, and stem cell therapy. Clinical trials are underway to evaluate the safety and effectiveness of these new approaches, offering hope for improved treatments in the future. Thank you for joining us today and learning more about diabetic neuropathy.